Welcome to Dr. Mai, sharing medical knowledge, where we delve into various health topics to help you live a healthier life. Today, we're going to explore an often misunderstood condition called vertigo. Before we begin, don't forget to subscribe to the channel, like this video, and leave your comments below to support the channel and suggest more topics you'd like to learn about. What is vertigo? Vertigo is a sensation that makes you feel like your surroundings are spinning or moving when, in reality, everything is still. This condition can disrupt your balance, making you feel dizzy and off-kilter. It's important to note that vertigo is a symptom rather than a disease in itself. It can arise from various health conditions, each requiring different treatments and management strategies. Symptoms of vertigo. Apart from the hallmark spinning sensation, vertigo can be accompanied by a variety of other symptoms, including nausea and vomiting. This can result from the brain receiving conflicting signals about your body's movement. Dizziness, a general feeling of unsteadiness or lightheadedness, especially when standing up or moving your head. Balance issues, difficulty maintaining your equilibrium, which increases the risk of falls. Hearing loss. This may occur in one or both ears, depending on the underlying cause of vertigo. Tinnitus, a ringing, buzzing, or roaring sound in the ears, often associated with inner ear disorders. Headaches. These can range from mild to severe and might be a precursor or result of vertigo episodes. Motion sickness, feeling queasy or ill when you move, especially when traveling by car, plane, or boat. A sensation of fullness in the ear. This can indicate fluid buildup or pressure changes in the ear. Nystagmus, a condition causing your eyes to move uncontrollably and rapidly from side to side, often a sign of an inner ear or neurological issue. Types of vertigo. There are two main types of vertigo: peripheral and central. 1. Peripheral vertigo. This is the most common form and is usually linked to issues in the inner ear or the vestibular nerve, which is responsible for sending balance signals to your brain. Subtypes of peripheral vertigo. Benign paroxysmal positional vertigo, caused by dislodged calcium carbonate crystals in the inner ear. Labyrinthitis, an inflammation of the inner ear labyrinth, often due to a viral infection. Vestibular neuritis, inflammation of the vestibular nerve, also commonly caused by a virus. Meniere's disease, a chronic condition characterized by episodes of vertigo, hearing loss, tinnitus, and a feeling of fullness in the ear. It's associated with abnormal fluid buildup in the inner ear. 2. Central vertigo. This type is less common and occurs when there's a problem in the brain, such as a stroke, tumor, or traumatic brain injury. Central vertigo often comes with more severe symptoms, such as profound imbalance and difficulty walking. Possible causes of vertigo. The causes of vertigo can vary greatly depending on the individual. Some common causes include migraine headaches. Migraines can affect your inner ear and brain, leading to vertigo. Certain medications, some antibiotics, anti-inflammatories, and cardiovascular drugs can cause vertigo as a side effect. Stroke. A sudden reduction in blood flow to the brain can cause vertigo, especially if the cerebellum is affected. Arrhythmia. Irregular heartbeats can lead to reduced blood flow to the brain, causing dizziness and vertigo. Diabetes. High blood sugar levels can damage nerves, including those that help control balance. Head injuries. Trauma to the head or neck can affect the inner ear or brain, leading to vertigo. Prolonged bed rest. Extended periods of inactivity can affect your balance system, leading to vertigo. Shingles. If shingles affects the nerves near your ears, it can cause vertigo. Ear surgery. Procedures affecting the inner ear can result in temporary or permanent vertigo. Perilymphatic fistula. This occurs when fluid from the inner ear leaks into the middle ear, causing balance issues. Hyperventilation. Rapid breathing can alter carbon dioxide levels in the blood, causing dizziness and vertigo. Low blood pressure. A sudden drop in blood pressure, especially when standing up, can cause vertigo. Ataxia. This condition affects muscle coordination and can lead to balance issues. Syphilis. An untreated syphilis infection can spread to the brain and inner ear, causing vertigo. Otosclerosis. This condition involves abnormal bone growth in the middle ear, which can lead to hearing loss and vertigo. Multiple sclerosis. MS can damage the nerves that control balance, leading to vertigo. Acoustic neuroma. A non-cancerous tumor on the vestibular nerve can cause vertigo and hearing loss. Complications of vertigo. While vertigo itself isn't usually life-threatening, it can lead to serious complications, such as falls. Balance issues can cause falls, potentially resulting in fractures or other injuries. Reduced quality of life. Chronic vertigo can interfere with your ability to perform daily activities, drive, or work. Social isolation. Persistent vertigo can make it difficult to engage in social activities, leading to loneliness and depression. Diagnosing vertigo. If you experience frequent or severe vertigo episodes, it's essential to see a healthcare provider for an accurate diagnosis. They will perform a physical examination and may recommend one or more of the following tests. 1. Fukuda-Unterberger test. In this test, you will be asked to march in place with your eyes closed for 30 seconds. If you veer or lean to one side, it could indicate an issue with the inner ear. 2. Romberg's test. You will stand with your feet together and arms by your side while closing your eyes. If you sway or lose balance, it could suggest a problem with your central nervous system. 3. Head impulse test. Your healthcare provider will gently move your head from side to side while you focus on a stationary target. Unusual eye movements during this test can indicate an issue with your inner ear. 4. Vestibular test battery. This series of tests assesses the function of the vestibular portion of your inner ear. It helps determine whether your vertigo is due to an inner ear or brain issue. 5. Imaging tests. If needed, your provider may order imaging tests like a CT scan or MRI to get a detailed view of your inner ear and brain structures. Treatment options for vertigo. The treatment for vertigo depends on the underlying cause. Here are some of the most common treatment options. 1. Repositioning maneuvers. These maneuvers are effective for BPPV, where tiny calcium crystals in the inner ear are misplaced. The Epley maneuver is a series of head movements that help move these crystals back into their proper place. A healthcare provider can perform this maneuver in the office and teach you how to do it at home. 2. Vertigo medication. Medications like motion sickness drugs and antihistamines can help alleviate vertigo symptoms in some cases. They are typically used for short-term relief. 3. Vestibular rehabilitation therapy. VRT involves exercises designed to improve dizziness, eye control, and balance. A healthcare provider will create a personalized plan for you, including exercises like stretching, strengthening, and eye movement control. 4. Surgery. Surgery is a last resort for severe vertigo cases caused by underlying conditions like brain tumors or structural abnormalities. It's only recommended when other treatments have failed. Managing vertigo at home. While some cases of vertigo require medical intervention, there are steps you can take at home to alleviate symptoms. Move slowly. Avoid sudden head movements or quick changes in position. Sleep with your head elevated. Using 2 pillows can help reduce vertigo episodes at night. Rest in a quiet, dark room. This can help ease the spinning sensation. Sit down immediately. If you feel dizzy, sit down to prevent falls. Squat instead of bending. This reduces the strain on your inner ear when picking something up. Use a cane or walking stick. If you feel unsteady, a cane can help prevent falls. Turn on the lights. If you need to get up during the night, having good lighting can help you maintain your balance. When to see a healthcare provider. If you have frequent or severe episodes of vertigo, it's essential to consult a healthcare provider. They can help determine the underlying cause and provide appropriate treatment. Seek emergency care if you experience vertigo along with chest pain, heart palpitations, sudden headache, difficulty walking, fever over 100.4 degrees Fahrenheit, 38 degrees Celsius. Vision changes, weakness in one arm or leg. In these cases, vertigo could be a sign of a more serious condition, such as a stroke. A note from Dr. Mai. Vertigo can be a frightening and disruptive condition, but it's usually not life-threatening. Understanding the causes and treatments can help you manage your symptoms and improve your quality of life. If you're struggling with vertigo, don't hesitate to reach out to a healthcare provider for guidance and support. Thank you for joining us today on Dr. Mai, sharing medical knowledge. Don't forget to subscribe to the channel, like this video, and leave your comments below. Your support helps us create more valuable content on health topics that matter to you. Stay healthy, and we'll see you in the next video.